Hello everyone, welcome back to my YouTube channel, The Exploring Medico. So I'm back with the series of respiratory system where today we are going to discuss about the mechanics of pulmonary ventilation, and this video will be divided into two parts. Today will be first part discussed. In the later upcoming video we will discuss the second part of mechanics of pulmonary ventilation. So this will be the entire sequence of the series. Do watch the entire series to sort out your all doubts. And I am trying to give the most relevant and most appropriate content which you can directly write in the exams as well as you can prepare for the competitive exams. So kindly like the video, subscribe the channel if you have not, share with your friends whether they are medical, paramedical, BSc nursing students, and let them also learn from this. And in case of any doubt, you can ask in the comment section. Okay, so mechanics of pulmonary ventilation. Introduction. As we know, respiration, to be more precise, the external respiration, that is supply of O2 from atmosphere to body tissues and removal of CO2 from the body to the atmosphere, both process vice versa, that is inspiration and expiration. Now this respiration involves three major processes. Today we are going to discuss is about pulmonary ventilation, that is exchange of gases between environment and lungs. Exchange of gases between environment and lungs. Then pulmonary diffusion, that is transfer of gases from alveoli to capillary blood across the respiratory membrane. Do remember, exchange of gases from alveoli to capillary blood throughout the respiratory membrane. And then third is transfer of gases, that is from the blood to tissue cells and blood. So now we are going to discuss about mechanics of pulmonary ventilation, where we will start with the mechanics of breathing. Pulmonary ventilation is accomplished by two processes. First is inspiration, that is inflow of atmospheric air into lungs, that is entry of air into lungs, due to which this obviously occurs when the intrapulmonary pressure falls below the atmospheric air pressure, means when the atmospheric air pressure AAP is less than the intrapulmonary pressure. Getting? It will be like this. So now if there is decrease in the intrapulmonary pressure, means if the thoracic cavity has a less pressure, then only there will the process of inspiration where the air will take entry in. Because if the pressure will be more, then you cannot inspire, you have to expire. So when there is decrease in the intrapulmonary pressure, at that time the process of inspiration takes place. Now opposite of it is expiration, that is outflow of air from the lungs into atmosphere. This is like this outflow, and this occurs obviously when intrapulmonary pressure rises, that is IPP is greater, rises than atmospheric air pressure. Getting? And here it will be opposite of it. So both process runs vice versa and simultaneously but oppositely. Now changes in intrapulmonary pressure is when, which governs the respiratory cycle of inspiration and expiration, are related to changes in the intrapleural pressure. So when there is changes in the intrapleural pressure, it ultimately leads to the changes in intrapulmonary pressure. So kindly have a good concentration to understand this topic, because this system will help you throughout your all the chapters, not only the physiology, but if you deal with pathology, microbiology, medicine, everywhere this system will be more helpful. And also it is more quite difficult to understand, but if you have a good concentration and if you are accomplished to it, then it will be easier. Now as we have talked that intrapulmonary pressure directly affects the changes in intrapulmonary pressure. So when now changes happens in the intrapleural pressure, we will discuss first changes in the intrapleural pressure are brought by the changes in the size of thoracic cavity. Expansion of thoracic cavity leads to the fall in the intrapleural pressure, and decrease in the size of thoracic cavity leads to the rise in intrapulmonary pressure. Now let's understand this. Expansion of thoracic cage means what? When there is entry of air, that is inspiration. So when there is inspiration, it leads to fall in intrapleural pressure. As we have seen, intrapulmonary pressure falls because intrapulmonary pressure is directly proportional to interpleural pressure. So if interpleural pressure falls, intrapulmonary pressure is also going to fall. Same way, if there is decrease in the size of cavity, when the size of thoracic cavity will decrease when there is outlet of air, outflow of air, that is expiration. So when there is expiration, there is rise in the intrapleural pressure. So if the intrapleural pressure will rise, obviously in expiration we have seen that the intrapulmonary pressure will also rise. So hence remember that intrapleural pressure is directly proportional to intrapulmonary pressure. So if one will decrease, another is also going to decrease. If one will increase, another is also going to increase. Is it clear? Now next, changes in the size of thoracic cavity are brought about the actions of respiratory muscles. Now we have seen that thoracic cavity increases, thoracic cavity decreases. Now that are the muscles. That is the action of muscles which is doing all these things. Now we will see which muscles does. First, muscle of normal tidal respiration. Normal tidal inspiration, tidal inspiration means intake of air, are diaphragm and external intercostal muscles. So if do remember this muscle name and the role. Normal tidal inspiration muscles are diaphragm and external intercostal muscles. Accessory muscles of inspiration are scalene, sternomastoid, serratus anterior and alae nasi. These all are the accessory muscles of inspiration which helps in inspiration. Now muscles of expiration are internal intercostal muscles and abdominal muscles. Now abdominal muscles are which? Abdominal recti muscles, transfer abdominis muscles and internal oblique muscles. These all are the muscles of respiration in short you can say, because this both plays a role in the inspiration as well as expiration. Now we will discuss mechanics of tidal respiration. Tidal respiration means normal respiration which includes both inspiration and expiration. Now inspiration. Inspiration is an active process. Why it is active process? Because you have to do some kind of efforts to inspire, but to expire it is easy. You don't have to do that much efforts. Normally produced by contraction of the inspiratory muscles. Now this is done by the contraction of inspiratory muscles that are scalene, sternomastoid, serratus anterior and alae nasi. These are accessory. And if we talk about the perfect respiratory muscles, then it is diaphragm and external intercostal muscles. Now where it is an active person in where the contraction of respiratory muscles, that is the contraction of diaphragm and external intercostal muscles, and hence it is called negative pressure breathing. Do remember this. Why it is called negative pressure breathing? Because as the diaphragm contracts, it will move down. Contraction of diaphragm will move down, and what will happen? The external intercostal muscles will contract along with the moving of diaphragm, and hence it will cause the lungs to expand. Getting first the diaphragm will contract. Initially it will contract the internal costal muscle. Both will contract means there will be the expansion of the lung, and this expansion of the lung will drop the pressure inside the lung. As we have seen, intrapulmonary pressure will decrease. Hence the decrease of the intrapulmonary pressure, due to that there will be the negative pressure where the air will be pulled inside, air will be sucked inside. That's why it is called negative pressure breathing. Do remember, okay? Now use of respirator to inflate the respiratory system produces positive pressure. That is completely opposite of this. Positive pressure breathing means what? There will be the release of air, there will be the decrease of the intrapulmonary pressure. There will be increase of the intrapulmonary pressure. That is positive pressure breathing. Now during tidal inspiration, that is quiet breathing, that is normal respiration, the diaphragm and external intercostal muscles contract and causes increase in all three dimensions of thoracic cavity. Now let's see about the role of diaphragm. The diaphragm is a dome-shaped musculotendinous partition. Musculotendinous partition means it involves muscles as well as tendons. That is called musculotendinous partition between the thorax and abdomen. So this partition is between the thorax and abdomen. Now the muscle fibers of diaphragm arise from xiphisternum. This is the process of it. Xiphisternum, inner surface of lower 6 ribs and lumbar vertebrae. These all are the muscle fibers from where they arise. Xiphisternum, inner surface of lower 6 ribs and lumbar vertebrae. And the convexity of the dome is directed towards thorax. So if we move to the thorax, it will be convex. This is the surface where the thorax leads. Now if we talk about the innervation of diaphragm, the motor supply to diaphragm is by phrenic nerve. And which phrenic nerve? C3, C4, C5. In tidal respiration, quiet breathing, 70 to 75% expansion of chest is caused due to contraction of diaphragm, because as the diaphragm contracts in the normal respiration, there is expansion of chest, that is increase in the surface area of chest. Now when the diaphragm contracts, following changes occurs. Now do have a proper understanding. First, the dome becomes flattened and the level of diaphragm is lowered, increasing the vertical diaphragm of the thoracic cavity. And during quiet breathing, the descent of diaphragm is about 1.5 cm. During the forced inspiration, it increases to 7 cm. So now, first of all, where there is entry of air, means when there is expiration, diaphragm is a dome space. When there is inspiration, the diaphragm shape, which is dome, becomes flattened. Now you can see in the figure. Now it was dome shaped. It is, see, dome shaped. Now from the dome shape, it becomes flattened. And level of diaphragm is lowered, increasing the vertical diameter of thoracic cavity. Now you can see this was this much area. Now area is increased compared to expiration. So when there is inspiration, when the diaphragm contracts, the dome becomes flattened, increasing the vertical diameter of the thoracic cavity. Now if you do the normal inspiration, quiet breathing, then the diaphragm descent, means the increase in the diaphragm cavity is about 1.5 cm. But if there is any kind of disorder, or if you are doing a forced inspiration, then the expansion is up to 7 cm. Do remember, okay? Now the descent of diaphragm cause rise in the intra-abdominal pressure, which is accompanied by the reciprocal relaxation of the abdominal wall musculature. Now this is opposite. It means what? When there is rise in the intra-abdominal pressure, there will be the relaxation of abdominal wall musculature. Means the abdominal wall muscles will relax when there is rise in the intra-abdominal pressure. And when there is contraction of the abdominal wall muscle, there will be the decrease in the intra-abdominal pressure. So this is vice versa. Do remember. Now contraction of diaphragm also lifts the lower lip, causing thoracic expansion laterally and anteriorly. Now thoracic expansion is laterally and anteriorly both, which is known as bucket handle and pump handle movement. This is bucket handle movement, this is pump handle movement. Do remember. Means when the bucket is lying and when you expand, see, the area was this much. But when you pull up the bucket, the area increases. This is the transverse expansion. And now this is pump handle movement. Means when the anterior posterior is lying and when you pull up the thoracic cavity, the ribs will rise, the sternum will rise. Still, we will discuss more in this only. The abdominal organ supports the diaphragmatic dome and acts as a fulcrum. Fulcrum means the support lever, while the diaphragmatic contraction raises the lower lips. Now, role of external intercostal muscles. Now we will discuss the role of external intercostal muscles. So the fibers of external intercostal muscles slope downward and forward. Now you can see it was like this. Okay. Now when there is inspiration, you can see the fiber is like this and in the forward direction, you can see. as per said, it slopes downwards and forward like this when there is inspiration. Attach close to the vertebral ends of upper lip than the lower lips. From pivot-like joint with the vertebrae, the ribs slope obliquely downwards. Now the ribs will go downward and forward. So this is the movement of rib. Now when the external intercostal muscle contracts because of the lever effect I told, the ribs are elevated. Due to this, the ribs becomes elevated as I told, which increase the lateral and anterior posterior enlargement of thoracic cavity, which is called bucket handle movement and pump handle effect. So when there is inspiration, there will be the rise in the anterior posterior aspect as well as transverse expansion, because when the air will come in, the dome shape will become flattened, so there will be the increase in the diameter, and the ribs will be lifted up, so there will be the increase in the anterior posterior expansion. So it is bucket handle movement and pump handle movement. Do remember with the figure. And when there is inspiration, if anyone asks you that what is the changes in the external intercostal muscle, then you have to say that it moves downward and forward. This is the movement of ribs. Now role of laryngeal muscles. The abductor muscles of larynx contract during inspiration, leads to contraction, pulling vocal cords apart. Now expiration. Expiration in quiet breathing, that is normal breathing, is largely passive phenomenon because you don't need to have to do this many efforts. So it is passive phenomenon. It's brought about by the elastic recoil of lungs, decrease in size of thoracic cavity, because as the air will go out, again the diaphragm will contract, so there will be a decrease in the size of thoracic cavity leading to the relaxation of diaphragm and the external intercostal muscles. Both the muscles and the diaphragm will relax, and there will be the increase in the tone of muscles of the anterior abdominal wall, which forces the relaxing diaphragm upward. Now as the diaphragm relaxes, again the process of inspiration is going to start, where the abdominal wall muscles will push the dome shaped diaphragm to become flattened shape. Do remember this force. When there is expiration, the process of inspiration is going to start. So relaxing diaphragm like this, which is a dome shape, so the muscles will pull abdominal muscles anteriorly and there will be the flattened shape. The serrator posterior inferior muscles play a major role in pulling down the ribs. In pulling down the ribs, the role of which muscle? Serratus posterior inferior muscles. Now, mechanism of forced respiration. As we have discussed about the normal, now we will discuss about the abnormal, that is forced inspiration. Now if there is forced inspiration, what are the changes we are going to see? Now forceful contraction we have seen. When there is forceful contraction of the diaphragm, the descent of diaphragm is about 7 to 10 centimeter compared to normal. In quiet it is 1 to 1.5 centimeter, but in forceful it leads to 7 to 10 centimeter, but generally it is greater than or up to 7 centimeter, less than or equal to 7 centimeter. Now forceful contraction of external intercostal muscles, causing more elevation of ribs. Now it will cause the elevation of ribs, that is this, when you do forcefully, and leading to more increase in transverse anterior posterior diameter of thoracic cavity, means the bucket handle and pump handle movement will rise. Both bucket handle movement and pump handle movement will rise because there is increase in the transverse as well as anterior posterior diameter of thoracic cavity. Now if we talk about the accessory muscles of inspiration, that is sternocleidomastoid and anterior serratus muscles, scalene muscles, and if we talk first sternomastoid muscles. Now sternomastoid muscles contract and lifts the sternum upward. Sternum will be lifted upward. So ultimately it is due to contraction of sternomastoid muscles. Anterior serrati muscles contract and lift many of the ribs upward. Now ribs is lift upward by anterior serratus muscles. Sternum is lifted by sternomastoid muscles, and scalene muscles contract and lift first two ribs. Do remember. Now this was about forced inspiration. Now we will talk about forced expiration. Forced expiration is required when respiration is increased during exercise or in the presence of severe respiratory diseases, and it is an active process as we have told. Now contraction of abdominal muscles, like abdominal muscles were abdominal recti, transverse abdominis, internal and external oblique muscles. Now compression of the abdominal content, which increases the intra-abdominal pressure. As we have seen in the expiration process that intrapleural pressure will increase and it will ultimately lead to the increase in the intra-abdominal pressure. So first of all, there will be the increase in the intra-abdominal pressure and the forces of the diaphragm upward, thereby reducing the vertical diameter of the thoracic cavity. So vertical diameter of the thoracic cavity will decrease as the diaphragm will be lifted upward and downward pull on the ribs and thus decrease in the anterior posterior diameter of thoracic cavity. So in this, pump handle and bucket handle movement will decrease. It will be the totally opposite. As in the forced inspiration, we were seeing that there was increase in the anterior, posterior and transverse diameter of the lungs. That was the rise in the pump handle and bucket handle movement. But in the expiration, you can see it is totally opposite. The vertical diameter and the anterior posterior diameter will decrease. That means it will be the decrease in the pump handle and bucket handle movement. That is fixation of lower lip so that internal intercostal muscles act more effectively. Second is contraction of internal intercostal muscles causes the effect which is opposite to that of external intercostal. Now in external intercostal muscles, what was the effect? It were moving downward and forward, like this movement was there, if you remember. Now here it is C. This is because of the leverage mechanism of the direction of muscle fiber, which is slope is downward and backward, creating a longer force arm for the ribs. Now here you can see the ribs is like this. It is downward, but it is lifted like this. So it is totally opposite. This was in the inspiration, but in the expiration you can see now it is like this, see, while in the inspiration it was like this. So these both are opposite. Hence their contraction tends to pull all the ribs downwards, reducing the anterior posterior diameter, that is falling of pump handle movement as we have discussed, as well as the transverse diameter, that is because of ribs falling in the bucket handle movement of the thoracic cavity. So as the contraction of internal intercostal muscles will be there will be the falling of pump handle effect as well as the bucket handle movement. Okay. Now note, beside their role in deep breathing, the expiratory muscles are also involved in the other forced expiratory efforts like coughing, vomiting, defecation as the process of passing of a stool, and Valsalva maneuver. Now Valsalva maneuver is a disorder in which the patient generally expire through nostrils and mouth or the glottis. It is an abnormal condition where the process of expiration is through mouth, nostrils or glottis. Now applied physiology we will see. In bilateral phrenic nerve palsy, means when there is phrenic nerve damage, adequate ventilation at rest can be maintained by the external intercostal muscle, because as the diaphragm have lose the innervation, have lose the nerve supply. So the work of the diaphragm in this condition, phrenic nerve palsy, will be handled by external intercostal muscles alone. But respiration is somewhat labored to maintain life. Getting? Now spinal cord transaction above the level of third cervical segment is fatal. Means when there is spinal cord transaction in the third cervical segment, it is fatal, that is life threatening. And when there is transaction below the fifth cervical segment, it is normal, remains normal, that is phrenic nerve, the innervation of the diaphragm remains intact. So it was about applied physiology. So if the diaphragm goes to the third cervical segment, it will become fatal, because there will be the interpretation of the white matter and grey matter of the brain, which are associated with the nerve roots, and hence it will disturb the cervicomedullary junction and tip of conus medullaris. So it will create a fatal effect on the respiratory system. But when it is normal, C3, C4, C5, then the diaphragm remains intact, means there is no effect. So it was all about today, where we have discussed the mechanism of pulmonary ventilation part 1. In the next video we will discuss part 2, Till that, revise the previous topics, watch the other series of the channel, and you can read the description of the channel where all the medicos who are assigned a specific subject are listed. So in case of any doubt, you can ask in the comment section. Okay, thank you, have a good day.